Welcome to the series Vitamins for Whole Health, short lessons on the vitamins that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about vitamin D. What is vitamin D? It is a fat-soluble molecule that we call a vitamin. It also has the properties to qualify as a hormone. Fat-soluble means it mixes easily in fats rather than in water. There are multiple different forms of vitamin D. Some are plant forms, like ergocalciferol, or D2. Cholecalciferol, or D3, is produced in our skin in response to a chemical reaction in cholesterol molecules initiated by ultraviolet radiation. But this is only the beginning, as cholecalciferol subsequently goes through several more phases to fully activate it for our body's uses. What does vitamin D do? Well, it's needed for our bodies to absorb the minerals, calcium, and phosphorus, which provide strength to our bone matrix and teeth and comprise our enamel. Vitamin D also regulates our immune system, both helping it to fight off pathogenic invaders, but also guarding it from becoming dangerous to our own tissues, as in the case of autoimmunity. Because the immune system is tied to every organ and system in our bodies, keeping it healthy also has the knock-on benefit of keeping cancer in check, preventing heart disease, managing diabetes, and preventing cognitive decline. And indeed, studies show that vitamin D has a part to play in each one of these instances. And since vitamin D receptors, or VDR, are present in almost all the tissues in our body, there are probably many more areas where vitamin D can help our bodies than we even know about yet. The classical signs of vitamin D deficiency in childhood are, of course, the bone deformities we see in the case of rickets. In adults, the bone-related pathologies don't look like poor growth of the bone, but rather poor maintenance. As the bone loses calcium and phosphorus from impeded absorption and deposition of these minerals, they first become softened, as in the case of osteomalacia, and ultimately porous and brittle, which we call osteoporosis. There is also evidence that vitamin D deficiency can make individuals more prone to seasonal infectious illness, such as colds or influenza. Now, how much vitamin D do I need? Well, for adults, if you're over the age of 19, that is 600 IUs or 15 micrograms per day. But of course, if you're 70 plus, that goes to 800 IUs or 20 micrograms per day for the older crowd. Some food sources. You can look at things like salmon and other fatty fish, dairy and fortified plant milks where they've added the vitamin D in it, egg yolk, and of course, as was mentioned with fortification, you do see this more and more in things like orange juice, other foods as well. Typically, the source there is either going to be D3, which is pretty darn good. Again, that's the form we make in our bodies in response to sunlight, or D2, which is the plant form. Jury's out on how well that works in human bodies, that D2. But of course, good option for the vegans, potentially. Now, as you remember me saying earlier, vitamin D is produced in our skin. It turns out that when ultraviolet B spectrum light, that is light that is between 280 and 312 nanometers in wavelength, right? We're talking about ultraviolet, the violet or purple side, beyond the visible spectrum of light. When that hits a certain subset of cholesterol molecules in the epidermis of our skin, it becomes cholecalciferol, the animal form again of vitamin D. That's only the first step, as I mentioned. Vitamin D has to travel then to the liver and the kidneys to become completely activated, but of course, that's beyond the scope of this presentation. Now, that ultraviolet B light, which is distinct from ultraviolet A, I'll mention that again in a second, is only able to get to Earth in the areas where the sun is 45 degrees or greater from the horizon, as you see on the slide. This means that you only have the potential to use these rays to produce vitamin D when you are taller than your shadow is long. As soon as your shadow lengthens beyond your height, your chance of vitamin D synthesis is over for the day. Now, I mentioned ultraviolet A. That does not produce vitamin D in your body, and you should note that while windows do allow visible light and ultraviolet A to pass through and hit your skin, windows block ultraviolet B light. That means you'll need to open the window if you want to sit inside and collect vitamin D from the sun. Now, the shade of your skin will dictate how much ultraviolet B can penetrate to the layer where vitamin D is made. Darker skin can take up to 10 times longer to make the same amount of vitamin D as lighter skin. So keep that in mind. Your, of course, latitude will also determine how many hours of the year ultraviolet B is available to you. So, who is at risk for a vitamin D deficiency? Now, of course, those who do not go outside, because if you're not outside, you're not producing vitamin D in your skin. That's obvious enough. Same thing with those who cover their skin with clothes or sunscreen when going outside, again, obstructing the skin from the ultraviolet B rays, which do not penetrate clothing any more than they penetrate windows, will cause them not to hit your skin and be making that vitamin D. Again, those with darker skin tones are more at risk considering it takes more time in the sun to produce the similar amount of vitamin D as the lighter skins, as I mentioned. And of course, the further you go from the equator, the fewer hours during the total year that ultraviolet B is available, which puts the darker skinned at even further risk in those areas. And of course, older ages where 7-dehydrocholesterol, that again is that subset of cholesterol, concentration is lower in the skin. That also means longer time needed in the sun to produce vitamin D. So, how do you boost vitamin D? Well, spend time again outside in the sun when the sun is greater than 45 degrees from the horizon. That is when your shadow is shorter than you are tall. Consume vitamin D rich foods and beverages, of course, and supplementing is an option up to 4,000 to 5,000 IUs, that is 100 to 125 micrograms daily, is typically regarded as safe. Obviously, that is in excess of the minimum recommended daily allowance, but again, generally recognized as safe, with some individuals taking still more on advice from their physicians. Again, take care not to burn when you're in the sun. That comes with other risks, as we know. All right, now, a minor form of vitamin D toxicity is possible from sun exposure alone. However, avoiding sunburn is generally enough to prevent this exposure from becoming too much. It takes a lot of sun to get vitamin D toxicity from the sun. Again, you're going to get sunburn before that's an issue. So just avoid sunburn, again, for skin health reasons as well. Now, typically, if there is a vitamin D toxicity, it is coming from supplementation. So talk to your doctor if you have concerns. The following are symptoms of vitamin D toxicity: anorexia or poor appetite, weight loss, irregular heartbeat, and of course, hardening of the cardiovascular system due to the overabundance of calcium ions in circulation can all be issues. Once again, talk to your doctor if you have concerns about toxicity. Thank you for watching the vitamin D section of the series Vitamins for Whole Health. Short lessons on the vitamins that keep our bodies functioning optimally. All the best, and we'll see you next time.